So let's talk about something that's a lifeline for literally millions of government employees and pensioners, the Central Government Health Scheme, or CGHS. It's an amazing benefit for sure, but let's be honest, the rules can be, well, a little confusing. So today, we're going to break it all down.
I mean, really think about that for a second. It's the middle of the night, you're in the middle of a serious medical crisis. Do you know exactly what to do with that CGHS card, who you're supposed to call, where you're supposed to go? This is why understanding this system isn't just about paperwork. It's about being ready when it really, really matters.
And that's exactly what we're going to do. We're going to declassify the CGHS, cutting through all that confusing jargon and red tape. By the time we're done here, you are going to have a super clear, step-by-step guide to using your benefits the right way, from just getting the card to handling a true emergency.
Okay, so first things first. Before we get into the how, let's cover the who. Who's actually eligible to get in on this scheme? Let's take a look.
Well, the main group, of course, is all central government employees, both serving and retired. But the scheme also covers a pretty prestigious list, including current and former MPs, judges, and even freedom fighters. And it's not just a Delhi thing anymore. The scheme is now up and running in over 75 cities all across India.
Okay, now this is a big one. This is where a lot of people get tripped up, the definition of a dependent. So let's make it super clear. Your spouse, always covered. Easy. Your parents? They're covered if they live with you and their income is less than 9,000 rupees a month, plus the dearness allowance. For your sons, they're covered until they turn 25 or until they start earning, whichever comes first. And for daughters, there's no age limit, but coverage stops if they get married or start earning. Okay, so you've confirmed you're eligible, and your family is too. Awesome. Let's move on to the next logical step, the actual process of getting that card into your wallet.
So the process is kind of a hybrid. You start online, but you finish offline. You'll head over to the official website, cghs.nic.in, and fill out all the details for yourself and your dependents. You upload your documents, pay your contribution, and this is a classic government touch, you still have to print out the final form at the end. So you've got this printed form in your hand. Now what? Well, this is where the path splits into two. If you're a serving employee, you take that form and your documents to your own department. Simple. But if you're a pensioner, you have to take your documents directly to the CGHS Additional Director's office in your city. That's a key difference.
Now here's some really good news. You don't have to sit around waiting for that plastic card to show up in the mail before you can get medical care. As soon as you submit your form, you'll get a printout of a temporary card, and that thing is valid for treatment right away. You are literally covered from day one. All right, you've got your card. Temporary or plastic, doesn't matter. Now for the most important part, the rules of the road. How do you actually use this thing for your day-to-day healthcare? This is the #1 question everybody asks. You're feeling sick, you have a fever, and there's a big, fancy, impaneled private hospital just down the street. Can you just walk right in, flash your CGHS card, and get seen? The answer to that is a very clear, very simple no. And honestly, this is the single biggest mistake people make. If you try to do this, you're probably just going to get turned away by the hospital, and you'll end up really frustrated.
And here's why. You have to think of the CGHS as operating on a gatekeeper system. Your designated CGHS Wellness Center, the dispensary, is your mandatory first stop. They are the gateway to everything else. For any planned treatment, you absolutely cannot bypass them.
So the proper flow is actually pretty straightforward. First, you go to your wellness center. A doctor there will see you. If they can treat you right there and give you medicine, great, they will. But if you need to see a specialist or get some specific tests done, they are the ones who give you that official referral slip. That slip is what unlocks your access to the private hospitals on the list.
And here's a fantastic pro tip for you. That referral slip isn't just a one-time pass. It's actually valid for 3 whole months for follow-up visits with that same specialist. This is a huge time saver because it means you don't have to go back to the wellness center for a new slip every single time you have a follow-up.
Okay, now let's talk about the money. You've got your referral, you're at the hospital. Who actually pays the bill? Well, the answer depends completely on whether you're a serving employee or a pensioner. And here is the absolute key distinction. For pensioners, it's a cashless system. You just show your card and your referral, and the hospital deals with the government directly for the payment. But for serving employees, it's a pay-and-claim model. This means you have to pay the bill out of your own pocket first.
at the approved CGHS rates, and then you submit all the paperwork to your office to get reimbursed.
Okay, so let's circle all the way back to that high-stakes scenario we kicked things off with. It's late at night and you are facing a genuine, serious medical emergency. What happens then? Do the rules still apply?
In a true life-threatening situation, you can pretty much forget all those rules about wellness centers and referrals. The absolute #1 priority is saving a life, and the system is designed to handle that reality.
So here's your emergency playbook. Step 1. Go to the nearest hospital that can help you. It doesn't matter if it's on the CGHS panel or not. Get admitted, start treatment. Let them know you're a CGHS beneficiary. But, and this is the most critical step of all, before you get discharged, you must get an emergency certificate from the doctor who treated you. That certificate is your golden ticket for getting your money back.
Now, just a quick reality check on the finances here. When you go to claim reimbursement for that emergency visit, the government is going to pay you back based on the official preset CGHS rates for whatever treatment you received. This might not be the same as what the fancy private hospital actually charged you. So just be aware you might have to cover the difference yourself. All right, to wrap all this up, let's talk about a couple of modern tools that can make managing all of this way easier, plus a few final tips that you'll definitely want to remember. Believe it or not, there's an app for this. It's called myCGH, and it's actually pretty useful. You can book your wellness center appointments, look at your past prescriptions, and even download a digital version of your card. But a quick pro tip: always carry your physical plastic card as a backup. And one final, super important tip: please make sure your mobile number is updated on the CGH website. So many things now require an OTP, and if they have your old number, you're going to be stuck.
And there you have it, the CGHS system, completely declassified. You've got the whole process now, from applying for the card to handling an emergency. So the only real question left is, are you ready? Is your mobile number updated on the website? Do all your family members have their cards? There's no better time than right now to check.